your body get used to bioidentical hormone replacement after being on it for a while, and it not be as effective? Would you just increase the dose at that point? Well, yeah, your body kind of can get tolerant to hormone therapy. That's why in a lot of cases, when I first start like testosterone on people, on men especially, note that women need testosterone as well, but talking about men and T replacement, a lot of times they'll be very low when they first come in. I start giving them shots or pellets or whatever, and they start feeling better and better and better. And then they expect that to keep going and going and going, but sometimes they kind of plane out and get them to a good high level. So they don't think it worked quite as well as when they first started taking it. But actually it still is. But there is a good point, because you can get tolerant to almost any medication. And so sometimes it's nice to kind of give a break from it, so you don't get tolerant. That's what's meant by cycling steroids. When all the weightlifters do it, they all cycle them. But, I don't do testosterone replacement for bodybuilders, of course. They want huge doses. Sometimes I see them back to straighten them out when they've totally zapped their pituitary gonadal axis, and I'll get them back to a normal level, high normal, not crazy levels. But anyway, you can get kind of a little bit tolerant. That's why sometimes I'll mix up the type of testosterone that I give with men and give it breaks. Sometimes I use shorter dosing, pellets, etc. But you're probably talking about the women's hormones, and usually creams that we use are preferably pellets, but because I think they work better. But that's one reason why if you're a lady and you're using the bioidentical hormone cream nightly, I suggest that you usually use it 6 nights a week instead of 7. So that kind of prevents some of the tolerance that you may build up, or sometimes just take a week off. So it's not bad to to take them every day or not to give breaks. But if you do feel yourself kind of not getting that effective dose, give it a break. And always remember, don't just up the doses of the hormones. I certainly wouldn't do that for you, but check the levels. The levels don't lie, either blood or salivary, but usually blood. So check levels and talk about the symptoms that you're having, because especially in females, it's those ratios of one hormone to another that really matters, instead of just getting them all as high as you can. You don't want that. So get levels. Let me know about your symptoms. But that's a great question, though. Really good question. Come in and see us about that.